Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Only 3 in 10 African countries are ready to deploy a COVID-19 vaccine. As the race for a vaccine nears the end, analyses based on country self-reports show that Africa has an average score of 33% readiness for a COVID-19 vaccine. This was revealed by the World Health Organization Africa Regional Director, Dr. Moeti Matshidiso, during a weekly webinar.
The average readiness score is 33%, which is well below the desired benchmark of 80%. So we are doubling down on planning and preparation because this will make or break this unprecedented endeavor.
We've seen that in different pillars in the preparation that we are following in the different countries. So countries are at a very different stage in those areas, and in particular with regard to cold chain, with the pre-existing system that are already handling the routine vaccination. So there will probably be a need to adjust a bit some of these, and we are currently supporting member states to make sure that the gaps are identified, and then resources be mobilized to as much as possible to fill those gaps before the deployment of the vaccine can start. So thank you.
The vaccines, including Pfizer and mRNA, have so far shown efficacy of up to 95% with no serious safety concerns. Some other companies are still seeking regulatory approval, but how will the global demand affect access for Africa?
We do know that African countries are concerned and hoping that pre-ordering of millions of doses of vaccine by wealthy countries will not disadvantage their accessing supplies. I think this is very much the issue of today that's being discussed all over, especially in the region.
So when will Africa receive its doses, and who will get it first?
Through the COVAX, we are aiming to have an initial supply of vaccines to cover 3% of the population, so the highest priority group to be covered. And we're expecting this will be healthcare workers and also, as has already been said, the most vulnerable group, which is the elderly. And the expectation or the plans of the platform are that some of these vaccines should start to become available late in the first quarter of next year. So progressively, we are expecting by the end of next year to have been able to provide vaccine to cover 20% of the population. And then,
but a number of challenges, including a lack of cold chain facilities for the vaccine, may be a stumbling block in the face of many African health systems.
Pfizer vaccine, which requires temperatures of minus 70 degrees, will indeed be a huge challenge for most of our countries to be able to provide the conditions to distribute countrywide. We think that the other vaccine, which is going to need minus 20 degrees, might be more feasible, but certainly the AstraZeneca vaccine, which although it has a lower efficacy, but it's certainly sufficient to provide population immunity at 70%, is going to be stable at the kind of conditions where African countries do have the capacity to distribute it, so it doesn't need this ultra cold chain.
Most of us are not that ready, but I think the discussions are really beginning.
However, Africa is participating in the manufacturing and clinical trials for the COVID-19 vaccine. Uganda and Nigeria are the only countries in Africa trying to make the vaccine, whereas South Africa, Kenya, and Egypt are taking part in clinical trials.
We haven't started our trial, but we want to go into a phase 1 trial using a self-amplifying RNA vaccine. And the plans are ongoing. We have delayed just because we want to really get the right doses that we need to use. But otherwise, we have had some preparatory studies going out to the communities to understand what knowledge do they have about vaccines, how acceptable vaccines are, especially in health, among health workers.
And how does the existence of a vaccine affect efforts of African countries participating in trials and manufacture?
This should not stop the research and development of newer vaccines. We don't know yet how long the immunity will last for these vaccines that are coming on. So there's a lot that we need to understand. Some of them, as you have heard, they need very cold storage, -70, -80. So newer products could come on that could be effective and easier to distribute. So I think the research and the trials should at the same time go ahead, although they will be more complicated and they will need larger trials because we already have a few vaccines that are proving to be effective.
The World Health Organization has provided a vaccine readiness assessment tool intended to be used by ministries of health across the region in preparation for the vaccine.
It is critical that authorities reach out to communities, listen to their concerns, and give people a voice in the process of developing and implementing the delivery strategies. It's also critical to fight against false anti-vaccine information.
Dr. Moeti Matshidiso also says they are mobilizing funding for acquiring the vaccines for the continent.
It's subsidized very much based on international solidarity and contribution by some donor countries and donor organizations. But there's an expectation that now that some funding, $12 billion, have been made available by the World Bank, countries will go to the World Bank or find other means to obtain a certain proportion of the money that they are going to contribute. Private sector partners, including the Exim Bank, are mobilizing funding to cover the rest of what the COVAX platform is not going to be able to cover. The COVAX platform is aiming to cover 20%, and we've heard many times from the Africa CDC that they would like to work with other partners to mobilize the funding so that we can relatively quickly get to 60% of coverage, at least to be able to have the funding to pay for that.
Africa has so far reported more than 2.1 million cases of COVID-19 with more than 50,000 deaths. The number of infections is also increasing, which is worrying health experts. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities